Hello, my name is Dr. Timothy Borelli, and I am the Medical Director of Infectious Disease at MaineGeneral Medical Center, and I serve as Chair of the MaineGeneral's Infection Control Committee. This video was recorded on March 17, 2020. Over the past several weeks, we have all become aware of a viral infection that has swept across the globe and into the United States and in Maine. On behalf of our Chief Medical Officers, Dr. Steve Diaz and Dr. Andy Dion, and our senior leadership team, I'd like to inform you about the current state of the coronavirus COVID-19 pandemic. This video presents information about the cause of this infection, where it came from, how it's spreading, its signs and symptoms, diagnosing and testing, how we can prevent its transmission, and most importantly, what MaineGeneral has done and is doing to prepare for this outbreak, and what we can do as an organization to continue to provide excellent, compassionate health care to our community. What is the virus? How did it get here, and how is it spread? The Federal Centers for Disease Control and Prevention is responding to an outbreak of a respiratory disease caused by a novel or new coronavirus. First detected in China, it has now been detected in more than 140 countries worldwide, including the United States, which is why the World Health Organization recently declared it a pandemic, and our President has declared a national emergency. The virus has been named SARS-CoV-2, or Severe Acute Respiratory Syndrome, and the disease it causes has been named Coronavirus Disease 2019, abbreviated COVID-19. Coronaviruses are a large family of viruses that are common in people and many different species of animal, including camels and bats. In humans, they are often one of the causes of the common cold, along with other families of viruses. Rarely, animal coronaviruses can infect people and then spread between people, such as what we saw previously with MERS-CoV, or Middle Eastern Respiratory Syndrome, in 2012, SARS-CoV in 2002, and now with this new virus. Early on, many patients at the epicenter of Wuhan, China outbreak had some link to a large seafood and live animal market, suggesting animal-to-person spread. Later, a growing number of patients reportedly did not have exposure to animal markets, indicating person-to-person spread. Person-to-person spread was subsequently later reported in countries outside of China, including the United States. The virus appears to spread in similar ways to the influenza virus and the common cold. This may include spreading through three main mechanisms: through the air by coughing and sneezing, through close personal contact, such as touching or shaking hands, and by touching an object or surface with the virus on it, and then touching your mouth, nose, or eyes. What are the signs and symptoms of COVID-19 infection, and who are at risk? The complete clinical picture of COVID-19 isn't fully known. Reported illnesses have ranged from very mild, including some with no reported symptoms, to severe, including illness resulting in death. While information so far suggests that COVID-19 illness can be mild, a report out of China suggests serious illness occurs in up to 16%. Older people and people of all ages with severe underlying health conditions like heart disease, lung disease, and diabetes, for example, seem to be at a higher risk of developing serious illness. Typical early disease symptoms for most infected people include fever, cough, and shortness of breath, which may appear 2 to 14 days after exposure. A smaller percentage of patients may later develop severe shortness of breath, confusion or lethargy, and persistent chest pain, especially with breathing. Who and how do we test for and diagnose patients with COVID-19? Under the latest federal CDC criteria, medical providers determine who should be tested for COVID-19 based on exposure history and appropriate symptoms. Those who exhibit symptoms of infection, such as fever, cough, shortness of breath, should be encouraged to contact a medical provider before going to a healthcare facility. Providers will screen individuals and use the revised federal CDC criteria to determine whether testing is warranted. People who are mildly ill may be able to isolate and care for themselves at home. For initial COVID-19 diagnostic testing, the federal CDC recommends collecting upper respiratory tract specimens with a nasopharyngeal swab or sputum if there is a productive cough. In patients for whom it is clinically indicated, such as those on invasive mechanical ventilation, a lower respiratory tract specimen or bronchoalveolar lavage sample should be collected and tested as a lower respiratory tract specimen. These specimens are tested for COVID-19 using reverse transcriptase polymerase chain reaction, or PCR. Typically, results for tests from the Maine Health and Environmental Laboratory Testing in Augusta, the Maine State Lab, can be expected within 48 hours of receipt. What is the current situation internationally here in the United States and in Maine? Current global estimates as of March 16, 2020 are approximately 180,000 cases, 7,100 deaths, and 79,000 patients recovering in over 140 countries. The mortality rate of the virus currently is estimated at 3.9%. These figures are being updated continually with rapid spread of the virus globally. Most U.S. states are reporting coronavirus COVID-19 cases. Collective reported statistics in the U.S. of March 16, 2020 were 4,645 total cases, 85 total deaths, and 17 total patient recoveries. In Maine, as of March 16, 2020, the Maine Health and Environmental Laboratory Testing reported 8 positives confirmed, with 9 presumptive positive cases. These figures likely will be changing constantly in the weeks ahead. How do we prevent contracting COVID-19 infection or its spread? There's currently no vaccine or cure for COVID-19. The best way to prevent illness is to avoid exposure to the virus. The virus is thought to spread mainly from person to person, between those in close contact with each other or within about 6 feet, and through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land on the mouths or noses of people nearby, or possibly can be inhaled into the lungs. The following are steps we should all take to help prevent the spread of the virus. Wash your hands often with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, you can use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, mouth with unwashed hands. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in our community. This is especially important for people at higher risk of getting very ill. Stay home if you are sick, except to get medical care. Cover your mouth and nose with a tissue when you cough or sneeze, and use the inside of your elbow. Throw used tissues immediately in the trash. Immediately wash your hands with soap and water for at least 20 seconds, and if soap and water are not readily available, clean your hands with a hand sanitizer with 60% alcohol. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water before disinfecting them. To disinfect, most common EPA-registered household disinfectants will work, including household bleach solution. Mix 5 tablespoons or 1/3 cup bleach per gallon of water. Do not use more bleach than recommended for this solution. You can also use disinfectants that are at least 70% alcohol-based. What has MaineGeneral done so far to address and prepare for COVID-19? The following are highlights of a compilation of actions MaineGeneral has taken recently in response and preparation for COVID-19. These actions are continually reviewed and modified as needed. We've had close monitoring of daily communications and updates from national organizations, including the World Health Organization, federal and state CDCs, the Centers for Medicare and Medicaid Services, American and Maine Hospital Associations, and others. We've been reviewing the latest medical literature on the virus and sharing with the teams closest to that care. We've been developing and implementing a system-wide screening effort at every site that we interact with our patients, including hospital, emergency departments, long-term care facilities, physician offices, express care sites, clinics, and at home, to both identify possible new cases of COVID-19 and also keep our patients, staff, and community safe. We've been providing advice to local schools, emergency response systems, and partners in the healthcare community regarding their preparations for the outbreak. We have been ramping up our education on proper use of personal protective equipment, or PPE, and fit testing of respiratory masks for those who need them. We've been developing staffing plans for multiple scenarios that could play out in the coming weeks, as well as how to handle acute human resource needs such as employee or family illness, school closings, and other factors that could affect our workforce. We've been collaborating with other Maine health systems to share ideas and meet larger community needs. We've had ongoing review of policies and procedures to meet the ever-changing situation. Please refer to MaineGeneral's website, www.MaineGeneral.org, for a current comprehensive list of details of our activities. What is MaineGeneral doing now about COVID-19? To be proactive, thoughtful, and coordinated, we implemented social distancing measures through Thursday, April 30th, to help prevent the ongoing spread of COVID-19. I will highlight some steps we are taking involving patients and visitors. We are canceling all public gatherings, events, and educational classes, those held inside MaineGeneral facilities and at community locations. We are reviewing medical appointments to determine if they should continue as scheduled, can be rescheduled, or done by phone. Staff will reach out to patients to screen for illness prior to confirming or canceling appointments. Visiting hours are limited to 10 a.m. to 8 p.m. 7 days a week. Patients and visitors at the Alphons Center for Health, Harold Alphons Center for Cancer Care, and Thayer Center for Health must enter through the main entrances. All visitors entering a MaineGeneral facility will be asked these screening questions inside the entrance by a staff member. Do you have a fever? Do you have a cough that is new in the last 14 days? Shortness of breath, a sore throat, or a runny nose? Have you been in close contact with someone who is sick with coronavirus or any other respiratory illness within the past 14 days? Patients going to an appointment at the Harold Alphons Center for Cancer Care should call ahead if they answer yes to any of the screening questions. We are canceling all student groups, tours, and job shadows in our facilities. We are restricting all visitors from MaineGeneral rehabilitation and long-term care facilities. Exceptions may be made in end-of-life situations. Again, a comprehensive list can be found on the MaineGeneral Medical Center's website. In terms of patient care operations and staffing, I would like to highlight the following measures we are undertaking. We are conducting patient screenings at our emergency departments, express care sites, and other outpatient facilities across our health system. We have established protocols for screening employees who are coming to work if the employee is returning from areas designated level 3 by the CDC, or has had close contact with someone with COVID-19, or is experiencing influenza-like illness or fever of 104 degrees Fahrenheit or higher, cough, and shortness of breath. Any employee who experiences any of these must email back to work at MaineGeneral.org for pre-screening before coming back to work. We are ensuring adequate supplies of protective equipment and lab materials are on hand for the safety of our staff, and are training and educating staff on emergency procedures and PPE use. In addition, we are discouraging all personal air travel, both domestic and international. We are planning for the potential that non-essential personnel may need to work from home, and looking at the impact on staffing if schools and daycare facilities are closed. Some staffing rules or responsibilities may change as we enact our organizational response to COVID-19, but no position will be lost due as a result of these measures. In conclusion, I thank each of you for your time and attention to this important matter. It is imperative that we, as an entire organization, work together to ensure we provide clear, consistent guidance to our patients in the community regarding the COVID-19 pandemic. This is not the work of just a few, it involves every one of us. We appreciate all the work you've already put in and the steps we may take as we continue to address challenges in the coming weeks and months. We want to assure you that we are working tirelessly to be prepared for whatever happens with COVID-19. We're constantly evaluating the situation and may alter our plans as new information and best practices become available. We will continue to share information with selected groups and all employees as we determine the need. We also encourage you to reach out to your leaders and with questions and concerns. We are meeting on these issues multiple times a day and will continue to do so as the situation progresses. General information on COVID-19 can be found at 211maine.org. Please contact Dr. Steve Diaz, Dr. Andy Dion, or myself if you have questions or concerns. Thank you.